So what are you guys' thoughts on opening up this Castaic Urgent Care as doctors?
Well, it's definitely a need. We've heard from members of the community that by a previous poll that this is a wanted service. We want to have a one-stop facility, as Dr. Prey mentioned, that people could just drop by, maybe, especially after hours, and get their problems met. People work now. It's tough to go to a doctor's office during banker's hours, and emergencies don't really have any time schedule. So ultimately, we hope to be open in the future 24/7. Right now, we're going to be mostly in the afternoons, early evenings, and then as the community support comes in, we will extend our hours, we will extend our days. Right now, we're planning on Monday through Saturday, but if the support is there, we'll be happy to open on Sunday. Right. And provide the service for the community, and later also include some teaching and diabetic education, whatever the feedback we get from the community. What the community wants, we hope to service.
And so it really is just about helping people, which is an awesome thing. Let's go over to Lee now. Lee, I know Lee didn't want to talk, but I'm going to force him to. So let's talk about your background a little bit.
My background is in nursing.
Go ahead and talk right into that microphone.
My background is in nursing. I've been nursing since the 1980s. I've done subacute to ICU, PICU, ICU, NICU, SICU. Right now, I operate and manage and supervise facilities that are for subacute patients. And I've also done urgent care. I did 18 years in urgent care in Ventura County. So I know the systems. I know the need that's out there. It's interesting when you talk about the Castaic area. There was a case study that was done in 2009, just basically asking random questions to the community. How would you feel about a medical practice being out here? And the feedback was like, oh, my God, please, do it. It's like, you're going to help me, versus me having to drive into Fraser Park, Valencia, Newhall, even down into the San Fernando Valley area. Saves time. I mean, what would you do? You have a loved one, a sick one. Would you out on travel, a great distance?
Exactly.
Or do you want to be able to be there in a couple of minutes and then have those needs met?
Great services that you guys provide. So maybe we can just dive into that. Do we want to start with Dr. Flores, maybe?
Well, again, the area, the local community can come in for illnesses such as colds, stomach flus, vomiting, migraine headaches. We will also be able to sew up a laceration, take care of the insect bites, and anything that does not require major surgery. No, we're not really going to be equipped to handle heart attacks or strokes. This is more of an emergency room thing. But short of major emergencies, we should be able to handle just about 90% of the usual problems that occur. And if you've ever been in an emergency room, you know how long the waits are. The nurse comes and she assesses you, and if you're not really critically ill, you go to the back of the line. And the waits, I think when I was practicing emergency room medicine, the national average was about 4 hours, and this was over 10 years ago.
Whew. Good grief. And so I want to talk to Dr. Prey on this one, when should we go to urgent care rather than go to the emergency room?
Urgent care is basically for minor emergencies, which can be handled in an office by a physician or a nurse practitioner. But what happens, I've been in practice in many years, and I see in Holy Cross Hospital, I'm on staff on Holy Cross. Every time I go to the emergency room, you have very sick people who need attention right away. They have people with chest pain who might have a heart attack, and they need to be attended first. But you also see people with a cough, cold, allergies, prescription to be filled up, a little laceration, insect bite, or they have mild dehydration, things, a flu, whatever, seasonal flu, and they clog the emergency room. And that's a big problem. The hospitals would encourage patients to go to the urgent care rather than come to the emergency room. And when you come in the emergency room, you're taking valuable time, resources, and then it gets very expensive. To run an emergency room is very expensive for the hospital. And if you're seeing only there insect bites, flus, then the expenses get shifted to the patient as well. So
it's expensive. You have to wait a long time.
Right.
It's not convenient.
Yeah.
But if you're really sick, that's the place to be. I mean, if you're having symptoms of a stroke or a heart attack, yeah, you need to be in an emergency room. I mean, that's where you're going to get your life saved. But for the other 90-some% of problems, they're handled in the physician's office, and specifically in urgent care, we do have the technology to take an X-ray, check simple chemistries, see if somebody's anemic or not, and then for the population that just needs a physical, like for driver's license purposes, this is a one-stop shopping thing, and without the excessive wait. And my mom was just in an emergency room, and Holy Cross is probably one of the top emergency rooms, and I probably should plug Henry Mayo in too because it's a local show. But
right.
the emergency rooms are staffed by specially trained emergency room technicians, nurses, and doctors. And so if you have a real emergency, you need to be in the ER. But again, the ambulance crews, they can make that decision. But the stuff that you can, the walking wounded things, that's urgent care. My mom waited, like most of her time was in the waiting room. She had fallen, she hit her head, she's elderly, she's had hip replacements. So we waited for a long time because she wasn't critically ill. And I'm thinking in the future, if we had a CT set up, I mean, this could have been taken care of in 15 minutes rather than 4 hours. And I have not seen the hospital bill yet, but I know it's going to be a doozy.
Absolutely.
So the cost, the wait, the emergency room has a specific purpose. I worked in emergency rooms. You have all of the resources of a hospital. You have the CT, MRIs. You can order any test through an emergency room. Urgent care, not quite that way. We have the basic stuff, X-rays and simple laboratories, but we do not have that extra technology, nor do we have the backup of neurosurgeons, and orthopedic surgeons right at hand. So there is a distinction when it's appropriate to use the ER, very bad situations, or urgent care, just about everything else.
Excellent.
As Dr. Flores said very well, that patients, when they have real emergency, would like them to go to the emergency room at nearest hospital and not to waste time. If you have a chest pain, is a impending heart attack or a stroke, the best place for them is to go to the emergency room in a nearest hospital. But our job in the urgent care would be minor emergencies, and whenever somebody walks with a real emergency there, we would stabilize or send them right away to the nearest hospital.
Yeah, we will have stabilization capabilities. We're going to have oxygen, we'll have IVs, we'll be able to do just about anything they do in the ER, but we are not an ER, and I want to make that very, very clear. We are not an emergency room. So if you're walking wounded, if you cut your foot at the lake and you need it sewn up right away, come to us. We'll evaluate it. Obviously, if it's pumping out blood, maybe we'll put a tourniquet and send you to the hospital because now you need something a little bit more. But our staff is going to be well trained. We're going to hand-pick.
Jump in all you want. What sets you guys apart from other urgent cares that you've been to, that you've been working with? What sets you guys apart?
Well, I think all of us can answer that. I think what's going to set us apart, number one, we're the only one in that area. That's number one. And the doctors can talk about the specialties and also subspecialties that's going to be working in conjunction with us. So not only would they be seen in the urgent care, but for those that need follow-up versus having to travel here and there, they can come back there as well because we will have subspecialties there. And the doctors can give you, more information on that.
We will also, this will be probably the only urgent care which will have an educational program. We have enough space there where we'll have community get together there, and we'll give them talks about like osteoporosis, diabetes, high blood pressure. So it will be educational also, what to do in case of emergency. All these will be scheduled like on a evening or a convenient hour, so the general public from the area comes and we have experts. We will be giving them talks on different topics on different dates.
but the community has to let us know what they're interested in. So if we have a high diabetic community, absolutely. And we know there's a lot of kids out there, too, and we have a very special clinic that will be provided by Dr. Feldman. Everybody in Valencia knows Dr. Feldman. She's one of the leading pediatricians. In fact, some people refer to her office as Children's Hospital, out here. Actually, UCLA. Excuse me, Dr. Feldman. And she takes care of special needs children. Everybody knows Dr. Feldman. She's going to be helping us, and we're going to be having a special pediatrics clinic from after 8 o'clock. I'm not exactly 100% sure about the hours yet. There'll probably be an evening clinic for children. So not only do we have us, Dr. Prey's internal medicine, I'm family practice /ER, but we will also have pediatricians available at the evening clinic. So that's going to differentiate with most of the other urgent cares, and God bless you, we need all the urgent cares we can get. God bless all the urgent cares in town. We're providing a great service. We're reducing the overuse of the emergency room. And I was asked how ours is a little bit different. And we do have this special pediatric service that I don't know whether it's available in other urgent cares or not.
Right.
And that's especially in this type of community that's very family-oriented community. That's a very important thing to have. Certainly.
Absolutely. And those hours we're looking at doing like 5 p.m. to 8 p.m. Monday through Friday. And then on Saturday, around the same time, the office hours would be that we would have the pediatrician there as well.
Excellent. So what type of, maybe this is a brand new facility, so what type of technology can we look forward to at this urgent
as far as like medical records and medical files, we're going to be doing eClinical Works. And basically, everything is electronic.
Electronic medical record.
Absolutely. Versus paper records anymore.
And that creates continuity, right?
That has the advantage also if they have a private doctor and he wants to know what happened yesterday. The patient went to urgent care. What did they do? We will next day he will get the whole record on his
a legible
computer.
Typed report will be on their fax machine, or if they have a computer system on their computer. We want to communicate with the local docs. So if somebody comes in with an ear infection, they will have the report in front of them, exactly our findings, which will be dictated, also our assessment, as well as what medications they're on, in case they forgot to bring the medication to the doctor with them, which happens quite a bit. So instead of having the doctor having the call and try to get that information, they'll have that information proactively.
One of the things that you had mentioned earlier was about continuity of care, and that is the whole reason for having that set up. So there is that continuity, and there's not like a guessing game. It's like, what happened, what is this, and what is that? So everything is presented to the doctors and physicians treating the patients so that we can continue to promote and have that continuity of care. About what separates us apart from other urgent cares. I mean, we all talked about different things and great topics, but one of the things about it is being able to provide more personalized and individualized care and know your patients. That will really
That's
set us
extremely
apart.
important for anybody.
Absolutely, and that's the reason to have the ongoing educational classes for the community. So when people come in there, not only are we just talking to them and knowing them, but we know the history behind them. We know what's going on. We know their family dynamics. So I do believe that will separate us a lot because, we've all had experiences where we went to restaurants and the food wasn't good. You don't recommend there. And you don't go back.
Yeah.
And so we don't want to get known for that. We want to get known for like, hey, you know what? You go there, they know you. They know you by name. It's like Cheers. You go to a place where everybody knows your name.
I like that. If I had Cheers music, everybody know I'd play it right now, but I don't have it with it. One thing that is important to mention also is this was put together this isn't a chain, is what Dr. Perret was saying. This isn't a chain, correct?
No, it's not a chain. It's Doctor and Lee. We are three of us driven together. It's doctor driven. So Dr. Flores and me, we've been in practice almost 60 years combined together.
Right.
So we are both in solo practice. We have wealth of experience, and we run our own practices. So we know how important it is to treat the patients with have good bedside manners, have the staff who attends them, who respects them, and who are efficient, and who know their job well, and who know which patient to treat in the ER and who to treat in the urgent care. That's very important for us, and that will be the hallmark of this urgent care. You will see the efficiency, you will see the attention paid to them, and bedside manners, and the staff, everybody will be trained to look after the patients very well. That's very important for me personally, and I'm sure for all of us.
That's something almost recently has taken the back seat to things. And I feel like at this point in your guys' lives, you guys really are just genuinely out to help people. Would
also,
I be?
It's fun. Come on.
Okay.
We're out to help people, of course. But actually, urgent care to me is fun. I mean, it's a part of medicine that you actually get to use sometimes you get to use your hands when you're sewing up a laceration, pulling out a toenail that's ailing somebody, pulling out that sliver that the person can't walk on their foot. I mean, some of the feedback in urgent care is actually a total joy. You can take care of a problem, have the person look at you, and when they say thank you, we listen. I mean, that's an honor for us when somebody looks at us in the eye and says thank you, because we know we've made a difference in their lives, and that's the fun of urgent care. The emergency room was also a lot of fun, but back then I was an adrenaline junkie. I don't need the adrenaline anymore. I just want to, make a slight difference in people's lives so that they can go on and enjoy their lives and continue what they're doing, continue enjoying and interacting with their friends and family. We want to keep that downtime to a minimum. So yes, it's bad when you're sick. It's bad when you're injured. Our job is just to try to minimize that time, not make it into days and things, which unfortunately with our system it sometimes occurs. We're trying to really minimize that time, minimize the suffering, get you.
During the break was why Castaic, and it seems like a kind of serendipitous. Bad things happen, but good things happen at the same time. Would you say
Absolutely.
That?
We were working on another project that was going to be in Canyon Country area, and that fell through. When that fell through, this chance and opportunity came to us, and we just grabbed it and ran with it. I mean, what better place to set up something that was already 90% in production, and then also servicing an untouched community.
Exactly, and I like what you said. It was just like you were saying something about Fort Apache and all that.
My brother lives in Lake Castaic, and I've heard his band play at Ralph's. It's a really nice, beautiful little community. You have the lake there, but it actually is toward the edge of L.A. I mean, this is like, and I'm looking at this as an opportunity. And I use the term Fort Apache because, like a fort, it's there to protect. And I just wanted to have something that is in an area that people needed the service. This is obviously that. Also, but the area is so attractive. I mean, where else can you have the lakes and still have nice restaurants? And this is also a major truck route. I mean, coming down the 5, I mean, do you understand how many trucks, what happens when the 5 closes? I mean, commerce it just stops. So, but I look at it, as an edge of L.A. This is, our Fort Apache, and our job is to protect the locals.
And it seems that you guys are really interested and making it a point to not only be in the community, but be a part of the community.
Absolutely.
Which is something that is really, really important for people, especially in the Santa Clarita Valley, because it's a tight-knit community. So it's something that definitely is needed.
And we're happy to provide that service.
Yeah. Yeah, and you know what? This has been the Castaic Urgent Care Hour. You guys have been wonderful. This has been, I've been talking with Dr. Luis Flores. Go ahead and say goodbye, Dr. Flores.
Goodbye.
Okay. Actually, I'll see you later. We'll do a see you
next week.
Yeah, exactly. And then we had Lee Jackson also.
Yes.
And
be here next week.
And be here next week. Same time, noon on Fridays.
That's correct.
From now until the end of eternity. So you're going to be here, right?
Right? Don't hold me to that.
And we also had Dr. Perret.
Yeah.
And thank you guys.
Next week. Thank you very much.
Yes, and this has been the Castaic Urgent Care Hour on your hometown station, AM 1220, KHTS.